Great. So hi everyone. First of all, thank you so much for being on a webinar on a Tuesday night at 6 p.m. I really appreciate the interest, and it's really exciting to see so many people want to be involved. And I was able to look through some of the questions that all of you had. You were asked if you wanted me to address some things, and luckily that is included in this presentation. But just in case, feel free to, in the end, stop me, and I can go ahead and answer some questions about CAPSA, about any information that I present. And then I also have a little treat for all of you. One of our CAPSA students from Toro, he's a DO and PH student who has been involved with CAPSA for quite a while. I think this is his third year, and he will be joining us at the end to talk a little bit more about his experience, specifically with an event I want to tell you guys a little bit more about. So like Adan said, my name is Angelica Ramirez. I am the Associate Director for California Physicians Alliance. And California Physicians Alliance is a statewide nonprofit who is composed of mostly physicians and other healthcare professionals who advocate for healthcare for everyone. We have a student group that's called the California Health Professional Student Alliance, or CAPSA for short. For some reason, we really like long names, so you'll see them spelled out both here. And our students are great. They are all over the state of California. We have 8 active and officially recognized chapters. We are open to all students, not only MDs or pre-meds, really anyone who wants to and believes that healthcare is a human right and wants to advocate for that. So they are all basically just activists who believe that everyone should have access to healthcare. So I'm just going to go ahead and get started. Most of the time when you go to conferences or you are getting a presentation about the health injustices or where the healthcare in the US is, you usually get something like this. You get a chart with numbers and comparisons to different countries, and this is great. I mean, it's great to have numbers, and it's great to be able to be subjective and compare it to other countries. Like in this graph, you see that the US, in terms of overall ranking compared to all of these other countries, we're number 11 for overall ranking. And this comes from looking at just the quality of care, the access to care, the efficiency, the equity, and the healthy lives, and the cost per capita. So this is always great to see because we have, like I said, a concrete number. But what I'm really trying to get through to our students and through this presentation is that we really need to be able to have this type of information, but also really narrow it down and put a face to it. Like, what does the chart really translate to? And it's really important to always be connected and always remember what those numbers actually mean, because it's really simple to disconnect yourself from the communities that are actually the most affected by these numbers and by inequality and inadequate access to care. So what you get, because the U.S. is number 11 on that chart since 2013. Right now it's actually 37 according to the WHO. But you get these huge mega clinics where people are lining up for hours just trying to get access to care, trying to get access to vaccines, to medical care. And I know for a fact that some of these are also dental care and maybe some vision care as well. And it's like families. What it comes down to, that chart really is about families, and we have to remember that these are individuals and these are people. So especially communities of color. So we really have to not only use that information of charts and numbers, but we also have to never forget that it is about people. So CAPSA really strives to do that. And in order to understand what is important about our system and why we have to advocate for these people, we have to understand how we got here, how we got to the current system that we have. Now, I usually give a much longer presentation about the history because it's actually really interesting to see all of the changes and the proposals that have been made. But I'm just going to give a really quick one here. And of course, you can always reach out to me if you have any questions. But I'm going to start with the Great Depression, because this was the first time that a president, President Roosevelt, was shifting the policies to focus on employment, retirement, and medical care. The reason for this is because people were suffering. I mean, from high school, Great Depression was a time of a lot of suffering, very little money, and just the government was finally going to step up and saw its role as providing services and making sure that its people were okay. So the Social Security Act was passed by Congress in 1935. And a lot of people don't know that initially the Social Security Act included a section that would have established national health insurance. But because of political compromise and surprisingly opposition from the American Medical Association, this was whittled down to just grants for maternal and child health. So not all women are mothers, number one. Not all people in the United States are women, and not all adults have children. So obviously this whittling down to just grants for maternal and child health really left out a lot of people. But I wanted to include that even after this failed, in 1937, there was a committee established to really continue the push towards national health insurance, which means that everyone would be covered. Another key point that I want to make about the history of healthcare reform is that to this day, a lot of people get their health insurance through their employer, right? If you have a good job, that means that you have health insurance. And if you lose your job, then you lose your health benefits. So the reason why we have that link between a job and between health insurance is because this law in 1954, basically the federal government gave employers tax breaks if they provided health insurance. So in 1954 is when we first saw this link between a job and health insurance begin to emerge. Now in the 1960s, Canada passed a program called Medicare, and the people in the United States looked up and were like, hey, that sounds like a great idea. Let's give health insurance to everyone. So we actually took their name, Medicare, and we tried to pass it here. So President Kennedy and President Johnson really pushed for Medicare, which would be national health insurance. But once again, because of opposition from the American Medical Association and just a lot of political compromise, instead what we got was Medicare and Medicaid signed into law in 1965. So Medicare and Medicaid are two programs, and Medicare is for those that are 65 and older, or if you have certain diseases, you get to qualify for it. But in the broad sense, we can just say that it's for those 65 and older. This is what the card looks like. And Medicaid is a federal term for what we have here in California that's called Medi-Cal. So this is a program for the poor based on federal guidelines. So they decide what poor means. So I know that in California, you can make up to $16,000 and some $100 to qualify for Medi-Cal. And this is what the old card looked like, the white one, and now it looks a little bit more colorful. So the way that I remember the difference between Medicare and Medicaid when I was, in school myself, I remembered it because we are caring for the elderly. So that's Medicare, 65 or older, and then Medi-Cal or Medicaid is just the other one. So that's a good way to remember them, and hopefully that will help you in the future when you're studying all of this health policy stuff. So for eligibility, once again, Medicare, it's age, and of course you have to be a U.S. citizen. And then for Medi-Cal, it's based on your income and how many people are in your household. For Medicare, you actually pay, if any of you have jobs, you pay a little bit through your taxes. So a small percentage is taken out from your every single paycheck, and it goes towards an entity in the federal government called the Centers for Medicare and Medicaid Services, and they use that money to pay for the Medicare bills. Now, since 1965, there really wasn't any change in healthcare at all. There were a couple of attempts, but they all kind of failed until March 23rd, 2010, when President Obama signed the Affordable Care Act. Now, this was a huge step, and obviously it's still in the news, and I'm going to talk a little bit more about that. But first, what did the Affordable Care Act do? It did a lot of things. There's 2,000 pages out in the internet that you can Google and download, and you can definitely go ahead and read it. Or you can just remember these four. The first one is that it expanded Medi-Cal. So once again, here in California, Medi-Cal is the program for the poor. And um, when I say expanded, it means that before the Affordable Care Act, if you were a single man that didn't have any dependents, but you were poor, you still wouldn't qualify for Medi-Cal because it was only for people that had dependents. So that was a problem. But now after the Affordable Care Act, you're able to get Medi-Cal. The Affordable Care Act also established the individual mandate. So the individual mandate, as you know, everyone has to have health insurance or else you get a penalty. Now, there's some exceptions to this, such as the undocumented, because they can't get any health services or health insurance. And also, there's a way to claim financial hardship. So that will avoid you getting a tax penalty. The third thing that it did was that it regulated insurance companies. So some of you have heard the number 26. So now kids are allowed to stay on their parents' health insurance plan until the age of 26. Also, pre-existing conditions falls under this. Before, if you had asthma, then you would probably get denied from an insurance company, or they would accept you and say, we won't cover any of your asthma medication for 2 years, which is kind of ridiculous because that's the reason why you need health insurance, right? So now the health insurance companies aren't able to do that. I also want to note that being a woman was considered a pre-existing condition. So women usually paid more for health insurance. So that also didn't make sense. The last thing that the Affordable Care Act did was that it established exchange marketplaces. So in California, our exchange is called Covered California. And I'm sure that all of you have seen commercials, heard it on the radio. It's pretty ingrained in our society now. And exactly what Covered California does, it's a website where you go and you can either sign up for Medi-Cal if you qualify for it, like I said, based on the number of people in your household and how much money you make. Or if you don't qualify for Medi-Cal, you can sign up for your own private health insurance plan. And those are all the companies like Blue Shield, Kaiser, Molina, all of those insurance companies. So those are all private. Now, to how Covered California works, first you have to determine your eligibility. So you have to look at how many people in your household and how much you make a year. And then here, like I said, $16,243 for one person. If you make less than this, you qualify for Medi-Cal. If you make more than this, you don't qualify for Medi-Cal, but based on where you fall, you can qualify for a certain amount from the federal government to help you pay your monthly bill. Once you figure out what you qualify for, you get to go on to the next level in terms of choosing a health plan. There's 4 different levels: bronze, silver, gold, and platinum. So with bronze, it's a 60% coverage because if you have a health bill, like whatever, you go to the doctor, the health insurance company would pay 60% and you would be responsible for 40% of the cost. With silver, they would pay 70, you would pay 30, gold, they would pay 80, and you would pay 20, and platinum, they would pay 90, and you would pay 10%. So there's 4 different levels. Each company has one plan that falls into every single level. So Kaiser, Aetna, Blue Shield, Molina all have a bronze plan. The place where people get confused is they cost different amounts. And the reason why they cost different amounts is because they decide that their network of doctors are somehow worth more. So not all of the doctors take every single plan from each insurance company. So you're limited to doctors from that plan. So if you get a Kaiser plan, you can only go to Kaiser doctors. If you get a Molina plan, you can only go to Molina doctors. and they have different clinics and all these things. So that's why they're different prices. So after, you get all the help and information that you can to make an informed decision. Overall, the Affordable Care Act really did do a lot of great things. 50 million Americans that didn't have access to health insurance, mostly because they couldn't afford it before the Affordable Care Act. Now, 10 million people have access to health insurance, and I'm sure that this statistic has increased since I made this PowerPoint. It is more affordable for most people, and I will be honest, I do mean most, because for some people the price did increase, but they might not realize that their benefits also increase, that they have more benefits now. And lastly, it established the principle that everyone should have access to health insurance. So it's becoming more and more common for people to talk about health insurance and to know, what health insurance is and which doctors with which company. So those are all great things that we're now talking about health insurance. The bad thing is that it's very confusing. I don't know if any of you have tried signing up through Covered California, but CAPSA actually has a group of certified application counselors, and it's students who are trained through Covered California, and they sit down one-on-one with individuals to go through an application. And the reason for this is because it's really confusing, and it really helps to have someone there who is knowledgeable and can explain the difference between the plans, all the terms, co-payments, premium, deductible, all of those things. Another problem, like I said, doctors don't take every plan. You can only go to Molina doctor, you can only go to a Kaiser doctor, like I said. And then lastly, plans offered aren't completely comprehensive. So even if you have the best plan, if you can remember, I said that they would cover 90% of the cost, not 100%, 90%. So 90% of a huge bill, I mean, you would be responsible for 10%, but even 10% of a huge bill can really be a lot of money for a lot of people. Medical bankruptcy is the number one reason. Medical bills is the number one reason why people are currently filing for bankruptcy. So it's still a big problem. Now, getting to today, where are we? I'm pretty sure that all of you heard about the American Health Care Act. If you haven't, you can just Google this, and there will be a lot of articles. And it is a bill introduced by the GOP, which is basically the right wing of the government. And in their bill, they were saying that they wanted to repeal and replace the Affordable Care Act. That is like their slogan. Ever since the Affordable Care Act was signed into law, there's been a group of individuals in the federal government, that have really been pushing to get rid of it. None of this has passed because President Obama wasn't going to let that happen, so he would veto any bill that would repeal his Obamacare, right? But now the federal government has changed, and the Republican Party really has control of the federal government. So they have been trying to agree with the bill, and the American Health Care Act is the closest that they've gotten to agree on anything, like with all the terms. So you've probably seen a lot of people that have, or a lot of groups that have popped up recently, Protect Our Patients, Protect Our Care, Fight for Our Health. All of these groups of individuals are using these slogans to fight against any changes to the Affordable Care Act. And CAPSA has been included in all of those efforts. So you see a lot of people that are going out into the streets, a lot of doctors that are lending their voice and lending their status to say that, it's not okay to mess with people's care, and even worse, to disguise it as a change when really you're just stripping people from their care. Now, what you can do, this is my pitch to all of you. The first thing that you can do is you can be informed. There is a CAPSA listserv at capsule.org, and we send out action alerts. And I'll talk a little bit more about the action alerts below. You can read kff.org, the Kaiser Family Foundation. It is a great nonpartisan website that regularly releases articles, up-to-date articles about what's going on. It's not too heavy on like the health policy subject. It's really easy to read. Highly suggest that you read that, especially if you're planning to go to medical school or any of these graduate schools. It will give you the language and the information that you need to be able to do well in interviews. And then, of course, you can follow CAPSA and CAP on Facebook. We post a lot of the articles there. We also post a lot of the events so that you can get involved. So being informed is great, and all of you are actually taking the first step by, being on this webinar. But I think what's more important is that you take action. Actions always speak louder than words. So what I meant by an action alert is we send out an email or we post on Facebook and say, hey, take 5 minutes to call your legislators, or we have a meeting with our legislators today. Can anyone make it? And it's really important. It seems like such a little task, but if you are able to call your legislator during a specific day, and we send this out to the thousands of people on our mailing list. You're one of thousands, but all of us doing it at the same time has such a big impact. Not only that, but showing up and being a warm body at a rally or a hearing for a bill or something like that. It shows the legislators like, look, there's actual people out there that want this, because they're used to talking to staff people like myself who are organizers and who do this for a living, who advocate for a living. But when we bring in actual people from the community, it just speaks so much louder. So really taking those 5 minutes to call your legislators is important. Like I said, you can become a certified application counselor through CAPSA, where we are always looking for people to help with enrollment if you want to get more experience in terms of what signing up for health insurance looks like, and then also just stay up to date about any changes. And most importantly, we have a Lobby Day 2017 taking place May 21st and the 22nd, so it's coming up really, really quickly. And this is a great example of really being involved and doing everything that's on this screen at once. The training the Lobby Day includes a conference. Let me see if I have a slide. Oh, there you go. So we really want to make sure that our students are able to use their voice and their privilege and their stature to make a difference. So these are some pictures of our past lobby days. We collaborate with about 80 different organizations who are part of the Health for All Coalition. And our students are the ones who basically run the day, the conference, and then our march and rally the next day. And for the past 2 years, we've been successful. We were able to expand Medi-Cal to all undocumented children in California, which is great. And then the year afterwards, we were able to make the state of California send in an application so that undocumented adults could access the Covered California system, because even to this day, if undocumented adults wanted to buy their own health insurance without any subsidies, without any help, they just can't. They're locked out. So this was before the presidential election, but that passed. The Governor Brown was okay with it. He signed it as well. And that just shows you that when people speak up, when students speak up, it really does make a difference. I mean, all of these individuals think of themselves as just one person, but when you bring all those one people together, we had over 450 people outside of the steps, and it was just extremely powerful. Not only that, but we make sure that you can develop the skills to properly advocate, and these skills can be applied to anything you're passionate about. But I'm guessing that all of you are passionate about healthcare, so this would be a great opportunity. And here, like I said, the Health for All bill was passed in 2015. And Capsule was the one that organized the conference and lobby day for that in collaboration with the Health for All Coalition. And then in 2016 was when Governor Brown signed the Health for All waiver. And like I said, we submitted an application, but then unfortunately, because of the presidential election, we had to withdraw it. But in 2016, we always want to make sure that the work that we're doing is actually creating the change we want to see and actually helping. So they ran some numbers, and the Health for All Kids program was working. I mean, a lot of people were signing up. There were more people going to primary care visits, and it's exactly what we are doing because we care and because we wanted to see these changes to happen. So this is just a really great concrete example of students lending their voice and just showing up, being active. So like I said, we have our Health for All conference and lobby day in 2017. It's going to be taking place in a couple of short weeks. We actually just sent out our Facebook page and our Eventbrite page as well, so it would be great if any of you can make it. We will have a lot of speakers that will specifically make sure that you develop power mapping skills, you develop skills on how to speak to your legislators, how to set up legislator meetings, and it's just a really great environment, really supportive. Great, so thank you very much. This is my presentation. I do, like I said, Matt, are you on the line?
Well, I think I am.
Perfect. Great. So everyone, this is Matthew Musselman, and he is a student at Toro, which is in Vallejo.
Yep.
And he has been involved with CAPSA for the past 3 years. He founded our chapter at Toro, and he was actually one of the volunteers for. He's been a volunteer for everything, but he's been at every single lobby day the past 2 years. So I thought it would be a good idea if we can open this up. Maybe Matt, if you want to start with a little bit about your experience with the lobby day, and then maybe the students want to go ahead and ask you some questions.
Sure. Hi, everyone. I am sorry I'm a little late to this call, so I missed most of Angelica's presentation, but yeah, I can talk a little bit about last year's lobby day for sure. I think, so just a little about myself. I'm a second year, almost done with my second year of medical school, and I'm currently in the middle of exams, and I apologize, I'm not very, well groomed at the moment or anything, but happy to be here with you anyway. And yeah, last year, my first year here, I founded a chapter of CAPSA at my school, and now, we've got our second generation of leaders taking the reins of that while I go away into my third year rotations. And so I'm a little bit hands off now, but back last year, we had a couple of students get together and say that this is something that's important to us. We want to have a group on campus that is, keeping track of what's going on in health policy and how it's going to affect us and patients in the future, because we feel like almost 99.999% of our education in medical school at least ignores all of this health systems policy that's going on all around us, and that's going to be our workplace for the, for the future from after once school's over. And so we created the club. We had some teachers at our school help guide us in terms of content, and we had some guest speakers come from the area to educate us and our peers about some of the, trends in health policy in the state of California and in the United States. And then Lobby Day came around about almost a year ago, and we, this was the anniversary of the previous Lobby Day, which I think Angelica told you guys about, had SB 4 get passed. And so this time, SB 10, we were working on that. And there's a picture of me and my classmate Heather off to the side, who we were just studying for a practical. Right? Yeah, that's me. And then Heather's all the way on the right side of that picture. And I was just at her house studying. And, it's been really nice to build these connections through showing up in to public events and being involved in the community. I think that's a great way to just get to know people, as well as you know, actually being able to make a difference in the policy decisions being made at the state level at the Capitol. And so, yeah, great experience in terms of the conference before Lobby Day. You know, some of that power mapping stuff has come in handy just on, you know, smaller projects here at school and things like that. And so definitely good skill building opportunity, as well as opportunity to network with other people who are passionate about health equity. And so, yeah, happy to answer any questions anybody might have or talk about whatever else for the next half hour or so.
Thanks. And I just want to point out that this guy right here, he is Keon Mitchell, and he used to be the coordinator for our student program about 3 years ago, but he's now a student at UC Davis, I think also a third year. And then if you notice any of Senator Lada's pictures talking about healthcare, you'll notice that Matt is behind all of them because we had all of the legislators come out and speak during our rally as well. So
my regards to whoever the photographer was. They made me look really good.
Great. So does anyone have any questions? Want us to expand on anything? I would love to have a conversation.
Hello, we have one question. The question is, when you first started your chapter, what were some of the difficulties you encountered?
Sorry, you said what were some of the barriers I encountered?
Some of the difficulties or barriers you encountered.
Sure. And who's asking? May I ask?
Yes, it's Pierre Escobar. I'm the facilitator, Adan, sorry.
Oh, cool. Okay, thanks for the question. Yeah, I think honestly the biggest barrier at my school to just starting a new club organization was there's a little bit of a paperwork barrier that actually ended up, I don't know, my school's a little bit difficult sometimes, and we had to go through a few different iterations of submitting, you know, our bylaws and constitution, which Capsule has templates you can use to draft that type of documentation. And then, you know, just getting through the administration at my school was a little bit of a headache for maybe, it actually took maybe like a month or two in order to get that taken care of. But while we were doing that, we just went ahead and started having, you know, small informal meetings and events, and really it's just a matter of getting your friends together and, you know, doing a little bit of outreach to other people who are interested to know about your event, and then people come and people talk and get to know each other, and that's sort of where the magic happens. So you know, just identifying people who would be allies in terms of helping do the work to plan an event and things like that. Once you get like maybe 4 or 5 people like that on board, and then, you know, you just hold the event. And I think our first event was a national, oh God, what was it called? It was called 10-1. It was on October 1st. Day of Action, yeah. And that was the national, you know, all the chapters of SNAP and CAPSA were doing a day of action in solidarity with each other in order to raise awareness for the injustices of our healthcare system. And we had a guest speaker come, who I believe Angelica helped us find a guest speaker, and we had a little bit of a storytelling powwow kind of thing where people got to share their experiences of interacting with the healthcare system. And a lot of my friends had really horrible stories of, you know, like one of my friends had a acute appendicitis and didn't go to the doctor because he thought that because he couldn't afford to go to the doctor, and, you know, that ended up getting way more complicated than it had to have gotten, and things like that. Just really heart-wrenching stories that sort of are very inspiring to why we're actually trying to organize and understand how health policy works, and and advocate to change health policy. So I hope I sort of answered your question. Any other things I can help follow up with? Feel free.
Yeah, Matt, you did answer my question. And thank you so much for sharing that story. I do have another one. In becoming a leader in health advocacy, what if I myself still require more knowledge in health policy? Would you say this would set me back in putting together an organization or chapter here? Because I'm from Cal State San Bernardino, so I've been interested in Capsule for a while. I've just felt that maybe with me not knowing too much about health policy might set me back up a little bit, or like maybe I might set myself up for failure.
No, 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 definitely not. So we actually expect everyone to be open to learning, number one, new things, and number two, we don't expect you to know any of this, because even as you know, people that are working in this, we learn about different things every single day. So we actually, that's why, and I should have explained this a little bit better. And during our lobby day that's coming up, we are going to take the conference as an opportunity to give kind of like a 101 overview to all the students that are coming, so that they start from the very beginning, how a bill becomes a law, what the budget process is, which is what we'll be working on this year, a budget process initiative. And then also just how to conduct legislative visits, what we're talking about when we mean, you know, about health for all, and what all of these other bills have done. So we're kind of trying to make sure that everyone starts at the same level, and we are definitely investing time into making sure that this happens. So in addition to this like large event that's coming up in May, we usually hold these conferences called Activate You. We had one recently in LA, and we had another one last year at UC Irvine. And we usually take these as an opportunity to, once again, give the 101, how a bill becomes a law, and you know, power mapping skills and all of that, that builds the foundation to really do whatever it is that you want to do with your group. And we also take it as an opportunity for our physician members in CAPA to mentor our CAPSA students, because our CAPA members have actually been involved with healthcare advocacy since the 60s. And they know, you know, what it takes and what it's like to be a student and be involved in advocacy. It is a little bit different just because it's been so long, and they will joke about that. But overall, they are more than happy to provide advice. And then, of course, CAPA itself, we have a staff member specifically to support CAPSA. So Annalie Gutierrez is our coordinator for our student program, and she is there to answer any question. And all of our students know that they can literally just send us a Facebook message, text us, or email us with any questions. And we have such a wide range of expertise in health policy that we're able to either send a speaker to you or send some slides to you. We're here to support you in any way.
And if I could just add one thing to that, I don't know nearly, like, I know the tip of the iceberg, if that, about health policy personally. And I mean, having gone through some training and having attended events like this, and it's really not, you know, you can spend your whole life trying to become an expert in health policy and still have a lot more to learn. And so it's really about coming at this problem from sort of a, you know, a perspective of like, what can I learn, rather than how can I be the expert. You know, like a humble sort of approach is better. And I guess I would also add that, you know, it doesn't take an expert to understand that things are not equitable right now in terms of how people access the healthcare system. And so, like, don't let that be a reason not to, you know, step into this role, because we need leaders and to solve these problems. And so, you know, we're all in this together. And so don't feel like you have to be an expert in order to be a leader in a CAPSA chapter. And you're gonna learn a lot, and you're gonna be the expert maybe among your group of people, but, you know, don't let that intimidate you, is what I'm trying to say. Thanks.
And that's a very good point, Matt. I also want to add that, I started this presentation by trying to move away from this academic viewpoint of health policy, and really trying to remember that it is about people. So I myself personally come from an underserved community, a very low income. So who better to be an expert in what is needed in these communities than people from the communities? So that's why even though you might not have the vocabulary for it yet, or you might not know the health policy terms, which by the way are sometimes repetitive and just unnecessary, like if you're from these communities, you know the experience. If you've worked with these communities, it's really important to be able to speak up and to be a part of this. And I really want to emphasize the fact that, U.S. students really do have a lot of power and an opportunity to really be involved and to have your voice heard. Usually the health policy field, honestly, kind of tends to skew a little bit in age towards the higher range. And, as future health professional leaders, it's very important that our voice is heard. So that's why I'm always encouraging Capsule students to just speak up, say what's on their mind, and not be scared. We are here to once again support you, and CAPSA itself is very open, and CAPA is very open to mentoring as well. But I think most importantly, all of us have to remember the power that we hold from our stories, our experiences, and maybe even just like our drive. So just giving a little pep talk.
Mm-hmm. Well, thank you so much, Angie. And that last question, because I know other people also have questions for you, but really quickly, where will the lobby day be taking place?
Yes, sorry about that. It will take place in Sacramento, at the Capitol. So the conference, it's a 2-day event. The conference will take place May 21st at Embassy Suites, which is a hotel right down from the Capitol. It's at 100 Capitol Mall. And then I can go ahead and send you the information. But that's the conference that will take place at the hotel. And we do have rooms available if any students need to stay overnight and all of that. I'll send the Eventbrite information as well. The next day, all of us are going to meet at Embassy Suites, and we're going to march with like chanting and all of that, signs like you see in the pictures. And we're going to march to the West Steps at 12:30. So that's a Monday. And the reason why we're doing this on a Monday is because our legislators are in their office on Mondays. So after the press conference that will take place, which is basically, Keon and Dr. Chen speaking and legislators and all of that, we actually set up meetings with your personal legislators, and you go in groups. Not only students, but also other staff for other nonprofits and other community members. You go in groups. You'll be trained in the conference on what to say and, like what you can add to it. But you go in groups and you talk to your legislators and you tell them that you want them to support Health for All. So it's a very powerful experience, and it will take place in Sacramento, May 21st and May 22nd.
Okay, thank you so much.
Mm-hmm.
Hello, Matt and Angelica. This is Adan. One person asks, what are some of the opposing arguments that you've encountered from those who do not believe in the Health for All movement?
Yeah, so there's a couple of different ways to get at the Health for All movement. The first one is this idea that, everyone deserves healthcare. Some people don't think that that's true, that blank statement isn't true, that, just the Health for All movement has been working with the undocumented specifically. And so the people that say this usually mean that undocumented individuals don't deserve access to health care. Most of their arguments are pegged on the fact that they are using state resources or federal resources. So that's one of the arguments, and our counter argument to that is actually that the undocumented paid billions in dollars in taxes, both federally and at the state level, but they're not able to access any resources. Popular to contrary belief, they can't. I mean, because of our work now, kids can access Medi-Cal up to the age of 18, but really the adults are left out. There are some county programs, and we can get into the details of, you know, how the undocumented actually access healthcare, but overall, they are shut out of a lot of resources that, you know, people think that they're using up. That's the biggest argument that we hear against our work.
Yeah, I've got an example. Sorry, I think my connection dropped a little bit, but right when I was beginning the chapter, I remember a conversation I had with someone, one of my classmates. So this is a medical school, and so this guy was asking me, or implying that, well, if we do Medicare for all, then physicians are going to get paid less, right? And that's a big disincentive for him and all of my other classmates to want to, you know, take a stance on this in favor of Medicare for all. But you know, first of all, that's ignoring the whole patient side of the problem, and second of all, and this is just off the top, what my perspective is right now as I'm telling you this. I don't know what I'm sure CAPSA and other organizations have, you know, more verbose statements on this, but you know, the way that a policy like this gets designed is gonna be fair to physicians if physicians are at the table when they're designing the policy, and the only way for physicians and medical students who are going to be physicians to be at the policy table is to actually get involved. And so, you know, I think, you know, so ultimately, I think it's a hypothetical sort of stance that the physicians are going to get paid less because, you know, or they could not be paid less if it's designed in a way that's fair to physicians. So. And I think there's a lot of different technical approaches to arguing about whether or not it's a, you know, a good system or a better system. But really, if you go back to the fact that, you know, you look at how much we spend versus the health outcomes that we achieve in terms of the system, and you compare that to other countries who do it differently, and that's a pretty simple comparison if you want to look at the numbers like that. And also the stories, if you look at stories of, you know, the poorest people here and their experience in the healthcare system versus the poorest people in countries where there's universal coverage, and they're quite different. So there's a couple
and
of
we
examples.
we have an FAQ section on CAPA, so caphysiciansalliance.org. We have a couple of, there you go, this one. caphysiciansalliance.org. We have a page that specifically has some of these questions that we're usually asked about, you know, all of the arguments against what we're doing.
Hello, everyone. Does anyone else have any questions? Feel free to unmute yourself. I see, Pierre, you're unmuted. Do you have any other questions?
Oh, yeah, just a really quick question. But I feel that Angelica might have already mentioned this already, but I could go ahead and email you and get more information starting a chapter, yes?
Yes, definitely.
Okay, just wanted to make sure.
And then
Or
I
if there
also
was
want to point
anybody
out
else that I should.
you know, like I said, CAPS is
Hello?
Hello, Angelica. Are you still on the line, Angelica?
Uh-oh, looks like we lost Angelica. Not sure what she was going to say, but if you do, you see her email there, and if you do ever want to get in touch with me, she can definitely pass along my contact info for whatever that's worth.
Okay, cool. I'd appreciate that a lot.
Looks like we lost Angelica. Matt, do you have any last minute advice for like pre-health students that are interested in health policy?
Sure. Let's see. I would say you never know when you're going to come across a unique opportunity to talk to someone. If you go to a town hall with your congressperson or just other community events, you may end up meeting someone there who is going to be a great contact in the future, or maybe even you'll have the opportunity to influence the way that a legislator thinks about health policy by telling them your story. And so you never know when you're going to come across an opportunity like that. So definitely, when you're able to, because obviously if you're a pre-health student, you have all this free time lying around where you can go and go out into the community. But when you are able to do that, take advantage and don't be afraid to share your perspective. Like Angelica was saying, that's definitely, your voice really is important, and so make sure you're getting it out there. And yeah, definitely, it seems like times are kind of tough nowadays with the way United States politics are going, but I think there's a lot of opportunity, so don't get down because of the way that's going. You guys, each of you have just unique skills that you can continue to grow, and the time will come when they're very valuable and needed to your community. So, definitely keep on fighting the good fight. And thanks for letting me talk with you guys today. Sorry, yeah.
Matt, before you go, can I go ahead and get your email address?
Yeah. So my last name's kind of long, but I'll spell it out. So my email is Matthew, Mattthew, .Musselman. I'll have to spell that. It's M as in Mary, U-S-S-E-L. M as in Mary, A-N. So like the seafood mussel man. And then at tu.edu. So feel free to, if any of you have any questions at all, definitely hit me up.
Can you repeat the last part one more time?
Yeah, and so it's matthew.musselman at tu.edu.
tu.edu. Okay. Thank you so much.
Just say from Capsule.
All right, cool. Thank you so much, Matthew. And if we could get Angelica back on the line, I thank her as well. And thank you, everybody.
All right, I'm going to take off. Thanks, guys.
Hello, everyone. Thank you very much for attending today's webinar. And just as a reminder, feel free to connect with us if you haven't already on mimentor.org and with us on the app. And also for upcoming events related to Mi Mentor, we have tomorrow the Together We Mentor postbac interview webinar for those of you interested in attending postbacs. And also, it hasn't been posted yet on Mi Mentor, but on May 11th, we'll have our part 3 of the health advocacy webinar series, and then also our part 4 on May 26th. And with that, thank you everyone for attending the event. Just to let everyone know, I'll be sending the slides to everyone. Feel free to fill the survey that will be sent to you after this presentation, and I should be able to send you a recording of this session for those of you that missed portions of it later tonight. Thank you all again, and have a good night, everyone.